بسم الله الرحمن الرحيم. الأستاذ الدكتورة عفيفة رضا عزيز، زملائي طلبة الدكتوراه فرع تمريض الأطفال، السلام عليكم جميعا ورحمة الله وبركاته. Outline my lecture: Physical Growth and Development, Motor Sequence of Development and Reflex. This lecture is continuation of the previous lecture that given by the assistant lecturer Asmahan Qasim. She is defined the growth as physical maturation resulting an increase in size of the body and various organs. Else defined the development as the process of functional and physiological maturation of an individual. It is progressive to increase in skill and capacity of function. Growth and development age periods. The infancy, the first stage, neonate from birth to 1 month, infancy from 1 month to 1 year. Early childhood, toddlers from 1 year to 3 years, preschools from 3 to 6 years, middle childhood, school age from 6 to 12 years, late childhood, adolescent, 13 years to approximately 18 years. Weight. First subject is weight to physical development. Weight is one of the best criteria for assessment of growth and a good indicator of health and nutritional status of child. Among Asian children, weight of the full-term neonate at birth approximately 2.5 kilograms to 3.5 kilograms. There is about 10% loss of weight first week of life, which regain by 10 days of age. Then weight gain is about 25 to 30 grams per day for first 3 months and 400 gram month till 1 year of age. The infants double weight gain their birth weight by 5 months of age, tripled by 1 year, fourth time by 2 years, 5 times by 3 years, 6 times by 5 years, 7 times by 7 years, and 10 times by 10 years. Then weight increase rapidly during puberty, followed by weight increase to adult size. Length and height. Increase in height indicates skeletal growth. Yearly increment in height gradually diminished from birth to maturity. At birth, length of a healthy Asian newborn baby is 50 centimeters. It increases to 60 centimeters at 3 months and 70 centimeters of 9 months and 75 centimeters at 1 year of age. In second year, there is 12 centimeter increase. Third years, it is 9 centimeters. Fourth years, it is 7 centimeters, and in fifth years, it is 6 centimeters. So the child double the birth by 4 to 4.5 years of age. Afterward, there is about 5 centimeter increase in every year till onset of puberty. This picture presents the measurement of length. Hair circumference. It is related to brain growth and development of intracranial value. Average hair circumference measured about 35 centimeter at birth. At 3 months, it is about 40 centimeters. At 6 months, 43 centimeters. At 1 year, 45 centimeter. At 2 years, 48 centimeter. At 7 years, 15 centimeter, and at 12 years of age it is about 52 centimeter, almost same adult. If hair circumference increase more than 1 centimeter in 2 weeks during the first 3 months of age, then hydrocephalus should be suspected. Hair circumference is measured by ordinal tap, placing it over the occipital, protuberance at the back above the ear, on the side and just over the supraorbital ridge, in the front measuring the point of high circumference. This tape to measurement of hair circumference above the ear, above the ear, on occipital and frontal. From fontanelle closure. At birth, anterior and posterior fontanelle are usually present. Posterior fontanelle closes early few weeks, 6 to 8 weeks of age. This depends on nutritional status and family heredity. The anterior fontanelle normally closes by 12 to 18 months of age. Early closure of fontanelle indicated to craniostenosis due to premature closure of skull sutures. This picture presents the fontanelle, frontal fontanelle. Chest circumference. Chest circumference or thoracic diameter is an important parameter of assessment of growth and nutrition status. At birth, it is 2 to 3 centimeters less than hair circumference. At 6 to 12 months of age, both become equal. After first year of age, the chest circumference is greater than hair circumference by 2.5 centimeters, and by the age of 5 years, it is about 5 centimeters larger than hair circumference. Chest circumference is measured by placing the tape measure around the chest at level around the chest at level of the nipple in between inspiration and expiration. Like this. Mid-upper arm circumference. This measure helps to assess nutritional status of younger children. There is a growth due to inadequate nutritional, which can be this simple, practical, and useful measurement. Like this picture. This average mid-upper arm circumference at birth is 11 to 12 centimeters. At 1 year of age, it is 12 to 16 centimeters. At 1 to 5 years, it is 16 to 17 centimeters. At 12 years, it is 17 to 18 centimeters. And at 15 years, it is 20 to 21 centimeters. Eruption of teeth. There is a variation for time of eruption of teeth. This depending else on nutritional status and the history of family. First teeth, commonly the lower central incision. Many appear in 6 to 7 months of age. It can be delayed even up to 15 months. Else can be considered within the normal range of time for teething. So dentation is not dependable parameter for assessment of growth. There are two sets of teeth, temporary teeth, bigger in size for two sets of teeth. This is schedule for the time of eruption of teeth and the number. We have two types of teeth, temporary teeth and permanent teeth. The total number of temporary teeth is 20 teeth, and the permanent teething total number 32 teeth. Another subject, motor sequence of development, gross motor development and fine motor skill development. Gross motor development, we means the large muscle, while fine motor the small muscle or specific muscle. Gross motor development progresses in an orderly sequence to ultimate attainment of locomotion and more complex motor tasks. Thereafter, in an infant, it is assessed and observed as follows. Key gross motor development milestone. Age and milestone. 3 months, neck holding. 5 months, rolls over. 6 months, sit without support. 8 months, sitting without support. 9 months, standing holding on with support. 12 months, crib wall stand without support. 15 months, walk alone, cribs upstairs. 18 months, runs. 2 years, walk up and down stairs. 3 years, rise tricycle. 4 years, hops on one foot, alternate feet going downstairs. Fine motor development. Fine motor development upon neural tract maturation. Fine motor development promote adaptive activities with fine sensory motor adjustment and include eye coordination, hand-eye coordination, hand-to-mouth coordination, hand skill as finger-thumb opposition, grasping, and then dressing. Key fine motor development milestone. 4 months, reaching out for object with both hands. 6 months, reaching out for the object with one hand. 9 months, immature pencil grasp. 12 months, pencil grasp become mature. 15 months, imitates scrabbling tower of 2 blocks. 18 months, scribbles tower of 3 blocks. 2 years, tower of 6 blocks, vertical and circular stroke. 3 year, tower of 9 blocks, copies circle. 4 year, copies cross, bridge with blocks. 5 years, copies triangle gate with blocks. Newborn reflexes. Reflexes are involuntary movement or actions Some movements are spontaneous, occurring as part of the body usual activity. Others are response to certain actions. Reflexes help to identify normal brain and nerve activity. This is very important. Reflexes help to identify normal brain and nerve activity. Some reflexes occur only in a specific period of development. Motor reflexes like motor reflexes, grasping reflexes, stepping reflexes. This motor reflexes, finger-like C shape, grasping reflexes, grasp anything by finger, stepping reflexes while holding the infant and the feet touch any surface. He start to step by step. Primitive reflexes, rotting reflexes by stimulate chicken and he turned head towards stimulation. This, like this, stimulate the and rotate to stimulation. Protective reflexes, sneezing reflexes, blinking reflexes, gagging reflexes. This is the end of lecture and this resource of my lecture. Thank you for listening.